Welcome back. So far we've looked at the history of the cloud, we've looked at platforms, and we've looked at emerging technology. In this final fourth segment, we're going to bring it together a little bit with some more examples about how to use cloud platforms and emerging tech. And for this, I wanted to do two things. Briefly give you a summary of some of the UK's experience in government digital transformation a few years back and what we learned, what we got wrong and what we learned. And then secondly, to give you, if you like, a kind of recipe. If you gave me a difficult task to reform and digitally modernise our National Health Service, and of course it's very similar to national health services everywhere in the globe, I would suggest a way forward, if you like, a playbook or a glide path to using cloud platforms and emerging tech to transform a health service. And with that, that should conclude this module on cloud platforms and emerging tech. So to get going, the question is digital once again about having a digital team? Here you can see some photographs from the UK's government digital service a few years ago, and you can see there's a distinctive style and approach here, which has done very well and has transmitted very well around the globe, starting with user needs and building digital services that meet those needs. And you'll see a lot of the iconography around that has, again, travelled very well to other digital services and administrations around the world. I argue that although there is absolutely nothing wrong with this is all very, very good digital data and technology expertise and culture within governments, what we of course need to do is to build that on top of cloud-based capabilities and services. We need to avoid thinking that just by building something around user needs we are being digital, because actually that's just really building modern technology. The digital part, as I hope to have explained by now, is all around thinking strategically about the business opportunities of the internet, cloud, emerging tech and platforms to digitalise the way that we do things in government. So in the UK, we had a few years ago a digital transformation programme. The UK government tried to digitise 25 services across 12 agencies and 8 departments. The essence of that programme was to move from traditional waterfall ways of commissioning technology that you can see on the top of this picture, where often months, if not years, may elapse between the commissioning of certain technology and the actual delivery of that technology, during which, of course, user needs change and things become irrelevant. And a move from the top to the bottom here, where you can see the kind of agile procedures of alphas and betas and go live and the iterative techniques of building technology around that. So that was the central thrust of the Digital Transformation Initiative around about 2012 to 2015-16 in the UK government. But the problem is, this is really, and I'm being a critic here, a constructive critic, this is really what it achieved. And you can see, of course, all of these silos at the bottom of this slide. So what we did was we often transformed the user experience for citizens, and that was a success. So for example, applications for, let's say, disability living allowance that might have consumed hours of time, been very difficult to engage with, and also consumed lots of paper forms, was now possible to do via a web form that takes a few minutes and is very much friendlier for citizens. But as you can see in some of these examples here, having done that front end, having produced a user-friendly front end, we are still stuck with the existing silos. And from then on, we treat everything in a digitized way rather than a digitalized way. So the essential structure of government functions in the UK was left largely unchanged by the Digital Transformation Initiative. It was a little bit like segueing the cavalry. In other words, again, just digitizing rather than digitalizing. Digitizing or modernizing a traditional way of doing things rather than rethinking how we're trying to do it. And in hindsight, this maybe is what we should have been doing. So rather, again, than just focusing on making that front end a little bit friendlier, but really leaving government at the back end exactly the same, we should have been thinking consistent with all of the messages so far on this module, with identifying what government does really, and how we can start to share some of those back-end functions and capabilities. Here you can see there's ring fences around lots of government departments that deal primarily with money, some that deal with law, or ownership, or permission, or tax, or benefits, and similar. And ways in which actually government could be reorganised to share and consume common capabilities and data around these important functions, so that in fact they could deliver a much more joined up, intuitive service to citizens at the front end. That, if in a sense, is much of what the UK learned. Because the reality is that the UK government, like many governments around the world, if not most governments around the world, are still stuck with the hard things. You know, transforming the front end service only goes so far unless we can tackle that legacy, that duplication, unless we can build those common capabilities and change the culture around willingness to question traditional hierarchies and ways of doing things in government. So how would I do things differently? I thought I would end this by giving you an example, if you like, at a very high level of how one can practically take a much more radical digital transformation approach to transforming a large government sector. So I'm going to think about transforming healthcare. And I would argue that this general blueprint might apply to anybody who's watching this video who's thinking about how to transform their healthcare function in their own government. Bear in mind, of course, that healthcare is becoming increasingly data-centred. People are becoming interested in wellness, preventing people from becoming sick, rather than spending their national budgets on treating many sick people who did not need to be sick in the first place. So healthcare itself is becoming transformed, whether or not we in government wish to engage with this or not. So I've outlined 5 steps which you might consider at a high level to think about transforming your own healthcare systems. And I would emphasise this is not something that has been tried here in the UK in this sense. The first step, try and build permission to touch your healthcare service in the first place, because many people rightfully feel very passionate about it and need to understand that the sorts of change you're going to be producing for the healthcare service will save it for future generations. Won't destroy it, it will save it. It will provide more doctors and nurses. So you've got to start to try and gain permission to do that. And I would suggest you can do that by quantifying the cost of the existing silos in your health service. So how much of the total health budget in your country is spent on non-clinical activity? Activities that don't involve a doctor or a nurse. All of that industry of back-end systems and consultants and technology companies and reorganisations and back-end functions duplicated again and again and again. And make that cost public. That will start to generate interest from citizens. Then start to talk about how you might start to consolidate those bits. The bits I've put out here in the red here. Those back-end functions which could be shared by all of the departments and health delivery functions in your country. And then, of course, start to really build much more of an understanding about the value add, the useful stuff that you do, shown here in blue. So that's a kind of step 1. And that's all about building that narrative for major change, having that public conversation, the legitimacy, getting citizens interested in digital government, because of course that's part of the problem. Most citizens don't think about it and don't know the art of the possible, how they could have more doctors, teachers, nurses, healthcare workers, dentists, etc., more and better at the front line by sharing things at the back. So explain the model, explain what's different. Have a conversation around the value of openness and sharing in the internet age. Acknowledge the good work to date, don't create enemies, but then set out a nice, clear plan to follow. And then get going on that plan. Transforming healthcare, step 2, if you like. So start approaching a wide variety of stakeholders here, clinicians, managers, architects, I'm talking service architects as well as technology architects, standards experts, people who understand health data, of course, that's a very specialist area, technology experts, cloud infrastructure and services, people who understand emerging platform-based business models of the type that I described in segment 2. And academics as well, of course, because we need validation and independent critique of things to build credibility. Otherwise, one administration and government will just be criticised by another. So start to have that conversation and build the narrative with a wide variety of stakeholders. Then you're ready for section 3, if you like, stage 3, prime the pump. You remember my picture of Google that had Google at the center of the platform with a wide variety and ecosystem of innovation and investment around that centrally curated platform. Well, this is the opportunity for government to be a centrally curated platform and to build an ecosystem of innovation, investment and care around that platform. So create a central health services team with real power to run those central infrastructural elements. And the sorts of elements we're talking about here are on the technology front, and I won't dwell on these too far because you will recognize many of these. You have to have secure, accessible records. You have to have interoperability. You have to be able to be secure to build the confidence in those technologies and automate anything humans do, even those sacred cows that people like doing, but anything that doesn't need a human, from frankly moving paper online to pushing trolleys in hospitals. And then you need an analytics layer underpinning the kind of risk prediction and healthcare analytics that provide this enormous opportunity to increase and improve clinical outcomes. So that's on the technology side. Moving to the capabilities side, and we talked a lot about standard capabilities here, these are the things you should be demanding of your healthcare ecosystem. The ability to see clinical records if you're a citizen anywhere and whenever you want. Core clinical systems to be shared, like radiology and imaging. Integration of clinical and support into a single person-centric record, bringing things together around patients, patient-centered care, if you like. A single costing system and seamless sign-on so that clinicians can communicate with one another securely. Data-driven alerting, so when things start to go wrong for people, and hey, we're all carrying mobile phones these days and increasingly kind of data watches, so ways of alerting clinicians to that. Data-driven system management, asset tracking, and then centralized functions such as procurement that make no sense to do again and again and again. So really try to drive out some of those common technologies and capabilities within this common services platform. That's what sits in the platform. Then, of course, around that you can start to build your ecosystem of the patients, of primary and secondary caregivers, and of course of the private and third sector. You can commission healthcare data out to big tech, to big pharma, to help them to innovate and invest in a vibrant healthcare ecosystem. The important thing is that you in government are controlling that data as a platform. You are using platform-based business ideas about cloud-based digital transformation to digitalize, to change those silos that we saw so much of before into a vibrant, innovative ecosystem. And then, of course, you can start to roll this out. We can see on the left, you can start to see common systems and capabilities being identified across many of those traditional silos. And on the right, you can then start to projectize what you're doing. So start maybe by prioritizing a hit list of which tech is currently most in use, and can we rank these? You might come up with a range of criteria for ranking which ones you're going to tackle first. I've listed some of those here. They're pretty obvious, but you would want to, of course, have a look at your own that are locally appropriate. And then, which delivery model is appropriate? Traditionally, of course, there's only one answer to that question. Government builds and maintains it. But in the digital era, as we've seen a lot of, there are many ways to do this increasingly. And increasingly, government building many versions of its own legacy technology is not the way to go forward, as we've seen. And then, of course, you can start to execute and drive traffic to the service. So you want to have a large advertising budget, for example, in common with all platform business models, because you have to persuade clinicians as well as patients to trust the service and to come on board with it. And then finally, of course, you can then look at maturing the new business model. So here we have the localism envelope, I've called that here. So everything that touches local patients, you should spend money on. That's where we need to really invest and prioritize local customization. But of course, the back end is all of that central services for which there is no public value in reinventing the wheel locally. And that distinction that's shown here on this slide is, in my view, the best way to encapsulate a truly digitalized health service, regardless of where you live. And of course, finally, because, as we've seen, the cloud-based tech and emerging technology market is evolving very, very quickly, we need to have a central review team looking at the relationship between what is local versus what it is much more sensible to run centrally, probably twice a year, because things are really, really evolving. So what is in each envelope of capability we need to be on top of all the time. So to recap, we've had a look at, of course, cloud, we've looked at platforms and emerging tech, and we've also finally looked at capability-driven approaches to business, in particular with the example of how to reform maybe your health sector and its contrast to what we learned here in the UK, which appeared to be much more service-based, but to leave those underlying silos fundamentally untouched. So my final challenge to you, remember that cloud and emerging tech is all about focusing on where you can deliver real best value, but also, of course, making sure that you leverage cloud-based utilities and services, get them to do the heavy lifting, if you like, wherever you possibly can centrally. Because if you can do that, you can start to adopt a capability-driven approach towards common sharing of assets, functions and processes across public administrations, which in turn and finally leads to a much clearer understanding, as we saw in the last slide there with the envelopes, about your business model. Where is it valuable to build and commission things locally versus where is it much better public value for money to consume standard capabilities from the centre? Thank you very much.